A nosebleed can look frightening, but most can be controlled with simple first aid. Do you know the correct way to stop one? Here's what to do, and what you should never do.
First step is to lean forward. Make the person upright and lean slightly forward. This helps prevent blood from flowing down the throat, which can cause coughing, choking, or nausea. Remember, never tilt the head backward. Thereafter, pinch the nose by using your thumb and index finger. Pinch the soft part of the nose just below the bony bridge. Keep firm, continuous pressure for 10 to 15 minutes. Breathe slowly through the mouth and do not keep releasing the pressure to check if the bleeding has stopped.
If bleeding continues, repeat firm pressure for another 10 to 15 minutes. A cool compress over the nose or cheeks may provide comfort, but pressure is the most important step. So what to avoid? First, do not lie flat. Second, do not tilt the head backward. Lastly, do not blow or pick the nose immediately after the bleeding stops, as this can restart the bleeding. And when seek help. Seek urgent medical help if the bleeding is heavy, follows a serious injury, causes weakness or difficulty breathing, or does not stop after sustained pressure. Remember, sit up, lean forward, pinch the soft nose, hold the pressure. Knowing the correct first aid could help stop a nosebleed safely.